Welcome to The Explainer. Today, we're diving into the story of a heart attack, one of the most urgent medical emergencies you can imagine. We're going to follow its path from a silent process that can start decades earlier, all the way to that final, frantic race against time to save the heart itself.
Think about this for a second. Every 40 seconds, right here in the United States, someone has a myocardial infarction. That's the clinical term for a heart attack. It's an absolutely staggering statistic. And behind every single one of those numbers is a dramatic biological story unfolding. So, what's really going on inside the body? Well, to get to the bottom of that, we have to go on a little journey. And you know what? This journey doesn't start with that frantic 911 call. Nope. It starts years, sometimes even decades earlier, deep inside our arteries. You see, the story of a heart attack is almost always the climax of a much, much longer story. A chronic condition known as coronary artery disease. So what is coronary artery disease, or CAD anyway? Well, the slide says it perfectly. Think of it like clogged pipes. It's a disease of the arteries that feed your heart muscle the oxygen it desperately needs. And the process that's actually clogging those pipes is called atherosclerosis. This buildup of plaque happens silently, slowly, over many, many years. It's a long-term process, not some sudden event.
This process doesn't just happen overnight. It's a slow burn, in four main stages. First, something damages the super smooth inner lining of the artery. Things like high blood pressure or smoking can do this. Then, cholesterol and other gunk start to stick to that injured spot. The body tries to do some damage control by forming a kind of fibrous cap over it. But over time, this whole thing gets bigger, and that cap can get thin and fragile. And that is where the real danger lies.
And that fragility, well, that brings us right to the moment when this long-term chronic problem explodes into an acute, life-threatening emergency.
So that unstable plaque finally ruptures. And that pimple analogy? It's perfect. It literally pops inside the artery. And your body, it goes into full-on panic mode. It thinks there's a serious injury, and its one job is to seal the wound. So what does it do? It immediately starts forming a blood clot called a thrombus, right on top of that broken plaque.
And this whole crisis, this sudden blockage, has an official name: acute coronary syndrome, or ACS. It's really just an umbrella term for what happens when that blood supply gets cut off. The key word here, you guessed it, is acute. This is happening right now.
This is such a critical distinction. See, many people with underlying CAD have what's called chronic stable angina. Maybe they feel chest pain when they mow the lawn, but it goes away when they rest. It's predictable. But unstable angina, that is a whole different beast. It's unpredictable, it can hit you when you're just sitting there, and it doesn't go away. It's a massive flashing red flag that a plaque has probably ruptured. Okay, the crisis has begun, the patient is getting help. Now the medical team is in a race against the clock to figure out exactly what's going on inside that artery.
How do they do that? They hook the patient up to an ECG, an electrocardiogram, which reads the heart's electrical signals. And that readout tells them something incredibly important. Is the artery partially blocked? That's called an NSTEMI. Or is it 100% blocked? That's a STEMI. And the STEMI is the big one, the most severe type of heart attack, and it shows up with a very specific, very alarming signal on the ECG.
You will hear this phrase over and over in emergency cardiology. Time is muscle. And it is the absolute truth. Every single minute that blood flow is blocked, precious heart muscle tissue is being starved of oxygen and is literally dying. And here's the kicker. That damage is permanent. You don't get that muscle back. So, yeah, time is muscle.
The body is usually screaming for help at this point. You've got the classic symptoms, right? That crushing chest pain, like an elephant is sitting on you. Pain that might shoot down the left arm or up into the jaw. And then all the other stuff. Nausea, breaking out in a cold sweat, feeling like you just can't breathe. And often, this profound feeling of dread.
But, and this is a huge but, it is so important to know that it's not always that classic Hollywood heart attack. For a lot of people, and especially for women, the signs can be way more subtle. It could feel like really bad indigestion, or a nagging jaw pain, or just being tired in a way you've never been tired before. Recognizing these atypical symptoms is absolutely life-saving.
All right, the diagnosis is in, it's a STEMI, the clock is ticking, and the race to get that artery open starts immediately.
The go-to treatment, the gold standard, is a procedure called percutaneous coronary intervention, or PCI, and hospitals have this critical goal called door-to-balloon time. The target is to get from the moment the patient arrives at the ER to the artery being physically opened, that's the balloon part, in 90 minutes or less.
So how do they actually do it? It's pretty amazing. A cardiologist snakes this super thin tube, a catheter, usually from your wrist, all the way up into the blocked artery in your heart. Then they inflate a tiny balloon on the end of it. That inflation just squishes the clot and plaque flat against the artery walls, reopening the path for blood to flow. And to make sure it stays open, they usually leave behind a tiny metal mesh tube called a stent. It's like a scaffold, just holding the artery open.
Okay, the blockage is cleared. That's a huge, huge win. But the journey is far from over. Recovery is all about rebuilding, and more importantly, managing this disease for the rest of your life.
So what happens to the part of the heart that was damaged? Well, it doesn't just grow back. It heals by forming a scar. And over time, this scar tissue can actually change the shape and size of the heart's main pumping chamber. This is called ventricular remodeling, and it's not a good thing. It can weaken the heart and lead to other problems down the road, like heart failure.
This is where a whole new support team of medications comes into play. You've got antiplatelets, like aspirin, to make your blood less sticky and prevent new clots. Beta blockers are there to basically tell the heart, hey, take it easy, rest up. Statins get to work aggressively lowering that bad cholesterol that builds the plaque. And ACE inhibitors, their big job is to help prevent that harmful remodeling we just talked about.
But meds can only do so much. The true foundation for a long, healthy life after a heart attack is all about lifestyle changes. And I mean all about it. This is the non-negotiable stuff. Quitting tobacco for good. Adopting a truly heart-healthy diet. Getting active again, usually starting with a supervised cardiac rehab program, and getting your blood pressure and blood sugar under tight control.
So here's the big takeaway. A heart attack feels like this random, terrible bolt from the blue, but it's not. It's the final act in a story that's been slowly, quietly unfolding for years. Understanding that story is the key to turning an acute crisis into a catalyst for a healthier future.
Thanks for joining us on The Explainer.